Are children allowed to be vaccinated? My name is Mobinah Ahmad. I'm the managing editor of AMUST News. I'm here with Dr. Habib Bhurawala, who is the head of department in Paediatrics at the Nepean Blue Mountains Local Health District. Dr. Habib, thank you so much for your time today.
Thank you. Assalamu alaikum, everyone, and thank you for invitation. A pleasure to be here today.
Wa alaikum assalam. Thank you. So, Dr. Habib, majority of Australians are vaccinated now, alhamdulillah. But now that the schools are reopening, how concerned do we need to be about children getting COVID?
Thank you. It's a very important question, and indeed, it's an important consideration now. Majority of adults are vaccinated, and so the biggest group of members of community who are currently not vaccinated are children, especially young children. So we need to be mindful of them that's a group which is more likely to contract COVID infection if there was an infection spreading around in community, and they are particularly vulnerable and not as well protected as vaccinated adults and other individuals. So we need to be concerned also because the schools have restarted, reopening has commenced. There is going to be more indoor gathering, mixed gatherings such as weddings and dining and movies and etc., where children are likely to be engaged with other members of the community. So we need to be mindful of them, that they may be more at risk of contracting COVID now compared to adult vaccinated population.
So if children do get COVID, how severely are they affected?
Up to half of the children don't get any symptoms of COVID infection. So that's a good thing about it. So they do get COVID, but majority of them do not suffer from serious illness as the elderly or adult population may suffer, which is good. Having said that, they still can have effect of COVID infection in young children. They can have fever, cough, runny nose, other respiratory symptoms. They also may have a diarrhea and vomiting and also abdominal pain. They may start to feel unwell, not eating and drinking as well, and may be at risk of dehydration. All of this it may sound like other viral infections or illnesses, but we need to be mindful of that it can affect some children. Small number of children can also need hospital admission, hospitalization. And we also have had incidents of children requiring intensive care, which is, for very serious illnesses, condition due to COVID. This is more common in children who have already pre-existing medical conditions. So they may have other health conditions which may make them predisposed to more severe illness because of COVID. An example such as, having conditions such as cancer or having some other chronic disease treatment, may have a diabetes, there may be obesity, other health conditions, genetic conditions, or delayed development, autism. All of these children are particularly more at risk of developing severe complications of COVID.
The health advice was saying that children couldn't get COVID, but now things have changed. Can you advise if that's the case, like that switch?
Yeah, so I think children do get COVID. They're less initially. It's all evolving situation, and certainly while any person of any age can get COVID, it certainly we saw more severe complications and infection in older population compared to children. But they do get COVID. We have had many cases of children getting infected with the COVID, especially also in the recent outbreak in New South Wales, and also it's been seen in Victoria. So they do get COVID, and certainly we need to be mindful of that.
Should children get the vaccine? Does the vaccine cause any harm, and does it have any side effects on children?
I think the children do get side effects of COVID vaccine like many other vaccines, and the side effects are again very similar to the other vaccines. And the commonest one which we know of is injection site pain, pain at the way the vaccine has been given, and that can occur in up to half of the children. Up to 50% of children can get that. 1 in 5 children, so up to 20% of children can get fever, usually within 48 hours of after receiving the vaccine, and generally responds well to the pain relief or fever medications, which they can get it from the pharmacy or get a local doctor's advice and administer that. It's no different to many other vaccines, and that they do have those complications. Serious complications are rare, very uncommon. And for example, there are some rare side effects been reported, such as inflammation or the swelling of the muscle of the heart, which we call myocarditis, and inflammation of the membrane or covering surrounding the heart, which we call pericarditis. These effects are much rare. There is an ongoing monitoring of those effects in children across the world, wherever it's been given in children, is more commonly seen in male young adults between 16 and 30 years of age, not as common in younger children under the age of 16. So that's reassuring, but it is something is recommended that we keep an eye, but it's much rare. Just coming back to your question around should they get the vaccine, definitely the health advice in Australia is that children up to the age of 12 years of age, all children should get the COVID vaccine. It's been recommended by the ATAGI, which is a national advisory body on immunization for Australian population, and also been approved by TGA, the Therapeutic Good Administration, which is the regulatory body which approves any vaccine used in Australia as like other medicines or devices and antibiotics and so on. So it is definitely recommended.
What can we do to protect young children under the age of 12, as there's no approved vaccine for children younger than 12 in Australia?
That's a very good question. And a lot of parents actually do worry about this, especially when they're starting to send the children to the school, since the primary schools have also opened, especially in New South Wales. What I would like to describe it in a word we call cocooning. So it is around, protecting them by, by vaccinating, helping those vulnerable children for which we do not have yet vaccine, all adults surrounding them. If they are vaccinated, we are actually protecting them in a way indirectly. So all the adults in household, all adults in the school setting, if they are going to the school, or if they're going to the daycare, or if they're going to the early childhood centers, or whatever they are, if all of those people are vaccinated, the less risk of them contracting COVID from those adults. Because children, majority of the children, when they get infection, it is not from other children. They get it from other adults. So there was a study done in New South Wales by National Center for Immunization Research very recently, and it was in the media as well. It has recently been published, I think, a few weeks ago. They've looked at, in this year's COVID outbreak in New South Wales, all the school transmission cases. They've investigated and they've looked at that. What they found is majority of the transmission in school settings have occurred between adult to adult, between two adults, or from adult to children. And a very small number of transmission has occurred from children to children. So all I'm trying to say is the message is, if you immunize, or if you have all the people, adults surrounding those children immunized, them transmitting or contracting COVID infection is much less. So that's the best we can do at the moment while we do not have an approved vaccine for children under the age of 12. That's the best we can do. Having said that, I might want to add for the viewers is that just recently, in last 2-3 days in America, so in last week of October, just had news that FDA in America has approved the Pfizer vaccine for children between age of 5 and 11. That's for use in America. There's still plans to roll it out in US, and we need to watch for that to happen before we understand what will be situation here. What we've heard is, and it was in the media in Australia as well in last week or so, that the Pfizer has also applied for the vaccine approval for Australia. So the TGA is currently reviewing that submission. We may not have an answer for a few weeks, but there may possibly be a vaccine available for the younger age group. Regardless of that, still what we can do now and what is an advice is that protecting those children is important by vaccinating adults and also having some other strategies which can help us.
That's some really great tips. I appreciate that. It was interesting to note that COVID has, the children are not getting it from each other, they're getting it from adults. And one of the ways to protect children is for all the adults to get vaccinated. Dr. Habib Bhurawala, can babies get vaccinated?
Not at the moment. It's a very good question. We do not have a vaccine approved for the babies. Babies can get COVID. And in fact, one of the group of vulnerable population is very young infants. So the infants can get COVID as well. And some of those infants do require hospitalization because they are very young. They do not have a very strong immunity against fighting infections, and they may get more sick. So again, the best way how we can protect them is especially for the pregnant women, the women who just had the baby or the breastfed. They all can, and all of those groups are also high priority groups and should get vaccinated. And that's one of the other way they can protect the babies from contracting COVID infection. But there are some studies in progress, also looking at more younger children, but it might be some time before we would have some results or any vaccines available for that group.
So babies can't get vaccinated. Just to switch up to another topic, once you do get COVID, are you immune from getting it again and you're not allowed to get the vaccine? What do we know about immunity?
That's a very good question. Thank you for that. It's often one point I want to highlight is the COVID infection does confer some immunity, but that against that strain of virus. We already know that there have been several different strains of virus have come. So we had an alpha strain, which was last year, and now we have a more transmissible Delta strain, which is a dominant strain in Australia currently. Now, having one infection, you can still get reinfected with a different strain of virus. So that it doesn't automatically means that you will not get a COVID again. You're still at risk of getting COVID again. It is similar to the flu, flu vaccine, which we having to take every year in Australia, for example. You may get a flu, but you can get a flu again. It doesn't always mean that you will not get again, because there are many different strains of flu and it changes. And that's why the flu vaccine every year have some adjustments made and some new strains being added. Same for COVID. Now, the vaccine we have available so far, what we have, based on the information we have, what we know, it can still protect against newer strain. It has protected against newer strain. So the vaccine was developed last year, and the Delta strain is this year, and still is holding up quite nicely. It's still fairly effective. So what we then tell us that in future, for newer strains, if you are vaccinated, you may still be more protected. Infection is not necessarily going to protect you. So while the immunity conferred by COVID infection may not get you the same strain of infection or protect you from that, it doesn't necessarily mean a guarantee that it will also protect you against new future strains of COVID viruses. I hope that is clear. So in summary, it still is advisable for them to get the COVID. What is the current recommendation is that you can wait for a certain time, up to 6 months period, and that depending on the health advice. So when you recover from COVID infection, you are provided with a documentation to say that you're exempt from getting vaccinated for a certain period of time. And after that, you're recommended to get the vaccine. So even if you have had a COVID infection, the recommendation is, eventually you still should take the vaccine because it will protect you against future infection.
So there is an exemption from getting the vaccine once you've had COVID, but that exemption is for a period of time.
Yeah, depending on the advice, what they say. And I think it's generally the advice is generally around 6 months. Some jurisdiction give 3 months, but we do know that for a certain period of time, it does give you some protection.
What are some ways we need to adjust our religious practices to ensure that we're in line with the restrictions, such as visiting mosques?
Yes, and I think this is really important, especially since the mosque has been reopened. So one of the what we need to look at is where the transmission occurs in masjids or mosque or Islamic centers, and try and mitigate that risk by several strategies. General advice is to follow the local regulations around the density and capacity and the space. So there are certainly some regulations around how many people in a given space can be there based on 4 square meters or 2 square meter rulings, which is there. Also, we have to ensure that there's generally other areas where it can transmit more is communal spaces. So the wudu or washrooms, those areas are where Also, gathering for extended period indoors can also lead that. If you are, one of the important key points to remember is that you may still transmit COVID even if you don't have any symptoms. And many people, before they start to develop symptoms, they may already be infectious. So we need to exercise caution not to visit mosque or masjid if you are slightly unwell at the slide, because you also want to make sure that you're not if affecting other vulnerable members of the community, especially elderly people, because they are the one who are more at risk, even if they are immunized. So we need to protect them. So avoiding that is helpful. Also having short congregation sessions, having some intervals between two sessions, or try and aerating that area, avoiding very crowded or poorly ventilated spaces. These are really important. Using using your own prayer mats, or trying to make sure that any of the communal use such as bookshelves or books or others, when it's been mixed between different people and so on, and there's no hand washing in between those, that can also affect. So use of hand sanitizers is very important as well. So all of this can help, and we all need to adhere to it. I think it's also been recommended currently to have the mask used indoor while visiting mosque. And there's certainly some evidence to show that using masks does reduce the transmission. So that is, again, very, very important. And everybody should try and adhere to those regulations based on the local public health advice.
Absolutely. Some really great tips there. Thank you so much. With over a decade experience as the head of department in pediatrics, what are some things that you've seen, in the past 2 years regarding COVID and the vaccine? Some common questions asked, or the health of the children, or the issues that children go through. What are some things that you've seen?
Look, I think what we have seen is that the pregnant women tend to get much worse COVID. Also, the infants and the delivery period can get affected. So when they're born, there might be premature deliveries. They may need to have intensive care stay. And so they're having COVID vaccination during pregnancy, during childbirth, or soon afterwards, at any stage, is highly recommended. We've certainly seen cases of them having more significant complications. We've also seen children getting admitted with the COVID infection. They have had complications of COVID, so it's not entirely mild illness. It's just not like flu. What we also know is that the children can get a rare but significant infection of complication of COVID is called multi-system inflammatory syndrome. It is particularly seen only in children. And there have been more than 4,000 cases of multi-system inflammatory syndrome in America. And more than half of them required stay in intensive care unit. And it occurs only in children. That itself is another reason why we should consider them getting vaccinated, because it can occur after some time, after the COVID infection, and that can affect them, as the name suggests, multi-system. And that would mean that it can affect the heart, it can affect the lungs, it can affect other parts of the body. So we need to be mindful of that. We've certainly seen cases, not as many in Australia compared to, say, in US, but that multi-system inflammatory syndrome also has been seen here in New South Wales. So I certainly would say to all the parents that it's definitely important that we get the children up to the age of 12 vaccinated. It's available for all the children, and it's quite, follow the advice. If you have specific concerns, you talk to your local trusted health professional, your GP. I would also suggest a website where there is a really good information available for the frequently asked questions, particularly around children and COVID and vaccination. And it's called ncirs.org.au, so National Center for Immunization Research. It is based at the Children's Hospital at Westmead, and it has a really good page advising all the simple questions and answers for all the parents who wish to seek more information on this area.
Dr. Habib, what have we found from news around the world pertaining to children and the vaccine?
I think children in America and in UK, they have started vaccinating children much earlier than we have. They have, especially in America, they've, at the last count, they vaccinated around 9 million children. And certainly it's a quite a large number. We have not seen a massive number of side effects or others which people are scared or worry about with the vaccine. Is also found to be quite safe. We also know that children who have had vaccinations, and some school districts in America where the children had vaccinations were, and some other more vaccination coverage than other school districts. And what they found is the COVID transmission is definitely less in those school districts where there is a more number of children who have had vaccine. So what is telling us that COVID does help in reducing the transmission of infection between each other. And so when we're trying to think about why we should vaccinate the children, we have to think about a couple of those points. One is to help them, to protect them. So they themselves are protected from serious illness. They're also less likely to have less disruption in the school because of the less school closures, because of the outbreaks, because there are more vaccinated children. And they've already missed out a lot of schooling. So we want to make sure that they actually get that important time back. And also there will be less risk of them having to quarantine every time when they get exposed to the COVID if they are vaccinated. Certainly, these are the advantages for them. The other, what I would like to mention is why we should vaccinate children, and what we've seen worldwide as well, is that when you vaccinate children, they also a part of it, in the chain of transmission. So they may be unknowingly a vector. They may not get a serious illness. They may not even know often that they have had an infection when they are unvaccinated and they get a COVID infection. But what they can do is they can come home and transmit to an elderly member of the family, your grandparents, so somebody who, even if they had 2 doses, because of their age, because of their other medical comorbidity, other conditions they have, they're still more at risk. So you do not want them to contract COVID because of some other members or in the family. So I think all of that is important, that as a community level, we also want to, the vaccine works best when there is a high vaccine coverage in the whole community. And the third reason I've already mentioned previously, that in children, there are rare but significant risk of long COVID, and more importantly, inflammatory syndrome. Now, multi-system inflammatory syndrome is another reason why we should be worried about it. Death, very uncommon in children, which is good, is reassuring. But I must say that in America, based on the Center for Disease Control data, which was just till last week, 700 children have died because of COVID. So it may sound a very small numbers compared to the large number of adult deaths, but we must remember that every death is, it's still important. It counts. Is somebody's son, daughter, someone's brother, sister, someone's grandchild. So I think all of those children's lives matter. And we must really not take it very lightly that, well, it's okay and it doesn't cause anything. A lot of those children did have other medical conditions. And that's another reason, if you have any other, is actually much better to really protect and vaccinate them as well.
We can see that the rate of vaccination is low in the Muslim community, whilst the Australian general community, people are getting vaccinated, but there are certain people in the Muslim community who are getting COVID and who are spreading anti-vax sentiments. What would you say is a good way to deal with this sort of issue?
Look, I think it's more the more we can do to try and transmit the information, try and help address the concerns and questions they have, provide them right information, and also give them information to really see that what is available to us, what are the recommendations, and when the information is coming from the community trusted health professionals from the community. And that would certainly be, I think, hopefully that would help those community members who might be still anxious or worried about taking vaccine or looking at other public health measures. There are several organizations who have done a lot of work in this space. Australian National Imam Council have issued a statement in support of the vaccine, which has been available for several months. And they have also mentioned that it's been permissible and halal, and it should be given. So there are scholars, Muslim scholars, who are saying that it's okay to have the vaccine, and it's in a collective opinion. Similar statements have been issued and recommendations been issued internationally. If we look at the medical experts' opinion, there was a statement issued by Australian Islamic Medical Association. I'm a member of Australian Islamic Medical Association myself as well. And that was issued, and it had also been published by the Australasian Muslim Times. So that really addresses some of the questions and concerns, and we can try and circulate that to the community to really look at it. Similar statements have been issued by the British Islamic Medical Association. So there are Muslim medics, experts who have also been at the forefront and helping with an education sessions. The number of other community organizations have been trying to address that. All we would try to say is that we all are members of the community. We are part of the community as a health professional, and we are trying to help our community address some of those issues. And we would urge all the members to try and seek the right information from trusted sources and try and help differentiate from the misinformation. And that hopefully will address some of the questions you raised around, particularly around our community, Muslim community, to try and improve the vaccination rate, as well as following other COVID safe behaviors and other health advice.
It is a matter of really dismantling the myths and misinformation that's been spread on WhatsApp and all the social medias. Unfortunately, many conspiracy theories. So AMUST has released a series of videos and content countering such misinformation, because it's just so harmful to spread unverified information that's based off of nothing. Dr. Habib, in your expertise and experience, do you see more Muslims in the hospitals in pediatrics?
We've not seen any. I mean, I wouldn't be able to comment on specifics of how many, different religions and communities have had an affected population. But what we do know in general, especially in Sydney, West and Southwest Sydney, the population, there is quite a significant proportion of culturally and linguistically diverse communities. And that certainly has been represented, because that's the population who live in the area. And I think it's quite reflective of the demographic of that area in the hospital admissions in general. There were some reports from Melbourne, which I've also seen, that there has been some increased numbers of Muslims in intensive care units in Victoria, which I've heard, through the media sources as well. So it's probably, certainly there is a bit more proportion of that population. What we do know, though, what I would like to mention is that in the UK, there is a BAM community, so British Asian minority and ethnic minorities. So British Asian ethnic minorities communities, so Black, Asians, and minorities, were significantly overrepresented in hospital admissions, in ICU, and in death in UK in the COVID wave. So we do know that some of those communities definitely are getting more affected, and that's been the trend, I think, at other places as well. So I do think that it is a concern that if those communities have low vaccination rate and there is a more proportion of them representing in the hospitals, it's important that we really need to advocate for more coverage.
Is there anything else that you'd want to share, in your role that you've sort of seen and come across that you would like to share to the multicultural community?
I think I would like to give a message that the COVID is there to stay. We need to learn to live with COVID. It's still, pandemic is not completely over. We still have to be cautious and follow all the measures. We need to follow all the measures, and we need to also follow the health advice. Certainly, the community members and health professionals have been trying to improve some of the myth and misconceptions, and also help with some of the information to try and get the right information. I would like to give a message to all the community members that, especially around the vaccination of COVID, that's the biggest group of in the community who is currently vulnerable and not vaccinated, and get the right advice. Look at the resources such as National Center for Immunization Research. Look at the frequently asked questions. And if you're unsure, talk to your GP or your trusted health professional and get advice.
To make sure that all information is from authentic sources, and to also get information from people you trust and who have a role and expertise in the in this field rather than just believing rumors from people of no knowledge. Absolutely. Thank you.
One of the advantage of vaccination in children is that you would be able to do certain activities which otherwise would be considered or deemed too high risk, such as travel internationally with children. And why I say that is because, especially in Australia, for last 18 months, many of us haven't really have an opportunity to travel anywhere, be it domestic or international particularly. And many parents with the young children would like to travel as soon as the restrictions are lifted. And having vaccinated children, it does give you and offer you an extra protection. So that certainly is an important consideration when we reopen. There may also be some requirement in certain overseas countries to have vaccination status. We're unsure about it as to how and what it would look like, but it would certainly give you an advantage. And also other activities for children, which they have always enjoyed, and we took it for granted in the past, but now we would really have to revisit before we start to do that. And that includes attending indoor gathering, mixed gatherings, such as weddings, such as movies, dining into the restaurants, and some of the other children's activities or sports. So I think overall, there's certainly some advantages of children having vaccinated because of these reasons.
I wanted to ask, what are your thoughts on separating or providing certain services to people who have been vaccinated and those who haven't? Like, especially with mosques, for example, do you think mosques should turn away people who have not been vaccinated?
It is a difficult, situation for a lot of those premises. I guess the one of the consideration is around, following the public health orders and the local health authorities advice, and if the regulations dictate that this is how it needs to be occurring and so on, those premises will need to follow. It certainly is a difficult decision for many, and I certainly don't have a particular view on that, because depending on which part of the country we live in, which states in Australia, or what are the local guide, it's different, and we need to follow that. So if that regulation stipulates that you need to have certain group of people only visiting certain high-risk venues, then we will have to comply.
All right, Dr. Habib, thank you so much for your time. We're so grateful for you to be able to come here and answer our questions and share your knowledge. It's much appreciated. And I'm sure that many people would have benefited from this.
Thank you so much for your opportunity. It's been indeed pleasure discussing with you. And I hope that, with your platforms and with all the good work done by AMUST team, Australian Muslim Times, you would certainly be able to reach much more wider number of community members and spread this message. But very happy to assist. Thank you so much.